Menopause is pretty much inevitable if you live long enough to get there. We wanted to talk to you about symptoms regarding your mental health that you might want to watch out for if you are in perimenopause. I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Laster,
And we're medical mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
So menopause in the United States is average 51, right? And so perimenopause is about 5 to 7 years before that, maybe a little bit longer for some people, or a little bit shorter for some people. So, around 43-ish, 42, you want to start thinking about symptoms related to your physical and mental health that might be showing up.
And it could start as early as like 35 in terms of being like that normal range. Also, in terms of menopause, what that means is you've gone 1 full year, 12 whole months, without having a menstrual cycle. So perimenopause is the time before that, and then menopause is when you've gone 12 months without a menstrual cycle.
We would kind of maybe see things along the lines of like increased anxiety, muscle tension, difficulty controlling worrying about things you might be new to worry about for you,
Feeling on edge, being really irritable, anger. Yeah, irritability and anger can be really prevalent. And just for some people, it's more like depression, like feeling really down.
sad, blah, blue, no motivation, no interest, no energy, just like that.
A lot of this happens for reasons related to hormone changes that are going on in your body around perimenopause. Your hormones are just shifting around like crazy, and they're not really following the normal pattern that they do. And so hormones like estrogen and progesterone have effects on your brain. So these shifts and changes can really impact how your mood and anxiety are doing.
Big ones to change in sleep.
Yes.
Difficulty sleeping, of course, waking up like with night sweats can interrupt sleep as well. Difficulty staying asleep, not feeling rested, those kinds of things related to sleep.
So because this is kind of a relationship with the hormone changes, for some people, like taking hormone replacement therapy can be helpful for these symptoms. And in addition, for a lot of people, hormone replacement therapy is good for lots of other different issues that come along with perimenopause.
Or maybe we need to reassess the psychiatric medications that you're on, or if you need psychiatric medications. So it's really a discussion for you to have with your doctor. We just want you to kind of know what you could notice or what you could see during that time, and make sure that you're aware and ready and kind of have an eye out for those things.
Yeah.
Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.